All right, everybody, welcome to Things. My name is Cole Jackson. This is a very special episode, an episode I believe that we needed to make in the recent crisis that is going on with our country, our state, and our county. We talked about it in last episode, kind of about the coronavirus, and while I think I'm well read, I'm not a medical professional. So I wanted to bring a medical professional onto our show. And I think this has been a great conversation. It is a great conversation. And if there is ever anything that you listen to, our sea of mine, this needs to be it. Right now in our county, before the filming of this episode, we had not had a positive case for COVID-19. During this episode, we have a tested positive person who is now hospitalized in Wichita Falls. Our guest today, Dr. Chance Dingler, from our medical clinic, our hospital, our ER director. He has joined me today to answer questions that I feel some people have been asking me. I've seen on the TV. I've seen on Facebook. So this is an important episode. I can't stress that enough. About health, about your loved ones, about what to do during this pandemic. Dr. Chance Dingler, he told me earlier that he believes he was exposed to this patient that has tested positive. So we are sitting at a safe CDC-regulated distance, and that is kind of why Rob will not be joining me for this episode. He is running the media over here, and we are separated from the doctor over there as he gives us very helpful information, and I hope this finds you. I hope you listen to this. I've wanted to help people for a while, and this is my route to do that. And so I'm going to give you the best information that I can from a doctor's mouth in our community, the guy who will be fighting on the front lines for your family. When it comes here. Not when, but it's here. This is the guy who's going to fight here to help us. And so listen on his recommendations and how you can help the hospital right now. Right now. So, again, thank you to Chance for coming on. Go ahead.
My name is Dr. Chance Dingler. I've been a physician here in Nocona for 21 years. I am the director of the ER, and I do inpatient rounds, work in the ER here at Nocona, as well as in the Nocona General Hospital Rural Health Clinic, both here in Nocona and in Bowie. So we see patients all day, every day, from infants all the way to elderly, both inpatient, ER, and then also in the clinic.
Okay. How long's the clinic been open now? Has it been way longer than I've been alive, I believe?
You're correct. The Nocona Medical Clinic was established going on 31 years ago.
Okay.
That was opened by Dr. Rusty West and Dr. Paul Reynolds. 2 years after that, my brother, Dr. Lynn Dingler, and then Dr. Chris Myers came and joined them. And then about 3 years after that, Dr. Myers left and went back to the Metroplex, and it was just Dr. West, Dr. Reynolds, my brother, Dr. Dingler, that were here for about 8 years, just those three. Dr. Reynolds subsequently left due to other issues, and then the year after that, they recruited Dr. Shannon Casey, and then 3 years later, I came.
Okay, yeah. See, because I've had a very short life up to now, obviously, but I've been around a little bit now. I've lived in the Metroplex area. I've been to other small towns, whether it be the school taking us around or stuff like that. And I'm so appreciative of what y'all do for us in our community because there are a lot of small towns that do not have what we have here.
You're absolutely right. Many towns don't have a hospital or physicians in their town, and if they do, they're not as active in the community as what we have been. Certainly, my brother and I have been the team doctors here at the Nocona High School for 20 years. I've been in it for the last 10 years myself. And we go to every football game and the majority of all the other sporting events that we can to be there in case a athlete gets injured, whether it's boy, girl, doesn't make a difference. We have been involved in the community as far as my brother was on the school board for 16 years. Dr. West was on several boards in the NEDC. I've been on the NEDC boards. And we try to give back. You know, it's important to give back to the town that you're in, try to make it your home and try to better it any way that you can. And I feel that the doctors here have done that. Our newest doctor, Dr. Kelly Roden, is phenomenal. She's just been out of residency since July of 19.
Yeah.
Started here in September of 19, and she's an incredibly wonderful asset. Smart, personable, and the appropriate amount of sarcasm to fit in with my brother and myself.
Yeah. Yeah, I mean, it just always blows my mind because, you know, I talk to people and I'm like, yeah, I'll just go to, you know, the clinic or the ER, and they're like, oh, you have an ER or in a clinic? And I'm like, you don't? Like, some people are traveling 45 minutes to see the doctor. I mean, sometimes that 45 minutes is life or death. So I think it's fantastic that we have that. I didn't know the privilege I had until I left here.
Our hospital is unique. Around the state of Texas, many small hospitals are floundering. They're losing money left and right. The Bowie Hospital has now shut down twice.
Yes.
Many other small hospitals in that situation have shut down. Munster went critical access, or they would be shut down. The hospital in Henrietta is hanging on by a thread. The hospital in Jacksboro just declared bankruptcy. So we just completed a $4.5 million paid for with cash renovation of our hospital.
Okay.
So while other hospitals are doing exceedingly poorly, our small hospital is a beacon of light.
Yeah.
Primarily due to the foresight of our CEO, Lance Meekins. He is incredible. He's a numbers guy. He started off as the financial officer of the hospital and then got promoted to the CEO job. So he's worn both of those hats. And through the stewardship of Lance, through the foresight of the medical staff, through the foresight of the hospital board, we have uniquely positioned ourselves as a very strong small hospital.
Yes.
If you look at the renovation that we've just done, it's state-of-the-art, wonderful and beautiful. And you don't see that in many of the big hospitals in the Metroplex as far as the quality of the environment.
Yeah. I've seen that the newer outside of it. I haven't got to go in, and I don't know when I'll get to go in the coming months, but that's kind of what I wanted to talk to you about too, kind of the main purpose I wanted to have. I really wanted to speak to someone with, you know, that was a doctor that had a medicine degree that could help fill in some things, because I saw, it actually spurred out of my mind because I saw someone post on Facebook, you know, and it was, and I'll kind of get to this question later too. It's just like, how are we preparing, you know, in case when it hits us, you know, when it hits us. And I was like, I just want to ask somebody. I just feel like asking somebody. But I think the first thing I want to ask, because I listen to the news a lot, and I've been listening to Dr. Fauci, I think that's how you pronounce his name. He's been kind of leading the country's, I guess, charge on this whole situation. I think he's incredibly intelligent, and I didn't really start watching the news like yesterday. I mean, I've been watching the news my whole life, so it's not a thing, but it seems like more people are watching the news, more people paying attention. There's panic, and there's things that people don't actually, you know what's right and what's not,
right?
Because everything's going around, especially with Twitter and Facebook. So I think I just want to kind of get into, you know, some of the nitty gritty, and if there's something that you can't answer for me or you don't know, because I'm just going to treat you as my all-knowing person.
All right.
So I know you like to hear that, but like seriously, if I ask something, you're just like that, you know, I don't assume that's what's going to happen, but
I will certainly tell you the truth as I understand it.
Yes.
And if I don't know, I'm happy to tell you that I don't know if I don't know.
That's exactly what I'm wanting. So yeah, I mean, you will certainly understand it better than I can or Rob can, because we don't have medical degrees. So I think what I first want to ask is like basically is what is a virus and how exactly does it separate itself between just a regular virus and a coronavirus?
Okay. So a virus is a non-living particle that uses part of your cells to replicate itself. It cannot reproduce itself on its own. It has to have a host.
Okay.
So it's parasitic in nature. So coronaviruses, there are many. The common cold is a coronavirus. So there are many, many different types of coronaviruses. This particular one, which has been nicknamed COVID-19 by the press,
Yes.
is a novel virus, brand new. We've never seen it before, which is why it's such a big deal. The common cold we have seen for generations, and you have natural immunities built into your system that your autobody immune system takes into effect. So as you're growing up, you're exposed to all these viruses, and so your thymus gland, when you're an infant, sees all these foreign things and develops antibodies to try to fight those specific things.
Okay.
So then later in life, when you are exposed to that again, your body develops an immune response to fight this. So we have no fight for the COVID-19 virus. We've never seen it, and so our body doesn't really recognize what it is, and it doesn't know how to attack it.
Okay.
We'll develop that over time, but as of right now, that's one of the big issues is we don't know how to fight it, our own immune system.
Yes.
We've got no drugs that fight it. In fact, we have no drugs that kill viruses.
Yes.
We have drugs that kill bacteria called antibacterial antibiotics. So if you get a strep throat, a tonsillitis, antibiotics are developed to kill that.
Exactly.
Those antibiotics work in two separate ways, which is a totally different discussion. But we don't have anything that kills viruses. The closest thing we have are our HIV medications for viruses. And while they don't kill it, they help our body's own immune system recognize and then destroy that virus. We don't have anything like that yet for COVID-19.
Okay. So since you brought up the drugs, I do kind of have two questions on that. I would say the first one is though, like, I saw a video. It was of a hospital in Italy. They had a doctor talking about it, and he was saying that because people have been comparing it to the flu,
Correct.
which is a virus, but not necessarily coronavirus, as I understand it.
Right.
So he said that it's not so much like the flu as in when it attaches to your lungs, it becomes a chronic pneumonia. And so with pneumonia, can't that be attacked with, or can you use antibiotics to fend that off?
If it's a bacterial pneumonia, yes.
Okay.
So one of the ways that I understand how the coronaviruses work, it is a respiratory virus. So it gets in your system via your nasal passages or through your oropharynx, your throat, and then it attacks your mucociliary escalator. Inside your trachea and your bronchial tubes, you've got a mucociliary escalator that beats. So if I'm out here, it's pollen season, so I'm breathing in all these things that are in the air, and they get trapped in my mucus.
Yes.
And my mucociliary escalator filters that back up. I then cough that loogie out. So it attacks the mucociliary escalator, so it doesn't work. So then it doesn't work. So all these particles and things get down deep into my respiratory system, into the lower respiratory tract.
Okay.
So if I'm not capturing these bacterial particles and getting them out of my system, then they're going to go down and they're going to start growing, and then I'm going to get bacterial pneumonia.
Okay.
So the antibiotics can help that.
Okay.
However, what we're seeing is you get such an overwhelming infection from this that your body can't catch up, and the fluids, the antibiotics, the things that we do are typically too little, too late.
Yeah.
So if you go on a ventilator with this disease, which is what we're looking at, about 4 to 5% of people seem to be sick enough that they wind up in the ICU, and typically those patients are going to then wind up on a ventilator.
Yeah.
Not many of those are going to survive that.
Okay.
The numbers are pretty staggering. 80% seem to have a moderate flu-like syndrome.
Yes.
And if you've ever had the flu, that sucks.
Yes.
Okay. Flu is a terrible disease, and we have people die from the flu every year. 22,000, 55,000, somewhere in that range every year, depending on how bad the flu is that year. Well, coronavirus, COVID-19, seems to be 10 times more lethal than influenza. It's 3 times more infective than influenza. So the numbers, if I get influenza, I typically infect 1.3 other people.
Okay.
Not a huge number.
Yeah.
Those 1.3 then go infect 1.3, and those infect 1.3, and so on and so forth. So one person typically can infect up to 50 people if you follow that chain out to 10 times. COVID-19 is 1 to 3. So I infect 3 people, those 3 infect 3, those 3 infect 3. You carry that out to 10. Now you're into 30 and 40,000 people that can be infected for one person. So it's exponentially worse than influenza by the number of people that get infected.
Yeah.
So go back to that 80% that have a moderate degree of flu-like symptoms. They get sick, they self-quarantine, 2 to 3 weeks later, they're better, they go about their business. They still feel sick, right? They still have to recover. So they're really out of commission for going on a month. 15% wind up in the hospital. They're sick enough to be in the hospital.
Yeah.
Those people are typically in the hospital up to 21 days. That's a long time to be in the hospital.
Yes.
5% wind up in the SCU, and a smaller subset of that wind up on the ventilator. So the numbers that we've got out of Italy are looking like 1% mortality rate.
Yeah.
So 1 out of 100 die. Okay? One out of like 10,000, I think it is, die with influenza. I'm not 100% sure on that number, but that I think I'm pretty right with that.
Yeah.
So that's a magnitude of 10 difference with COVID-19. So 1 out of 100 people that can die, if we get 80 million people infected in the U.S., depending on which study that I read or look at, 80 to 160 million people in the U.S. could be infected. 1% of 160 million is 1.6 million people could die from this. That's astronomical.
Yeah, it's crazy.
Okay? Our county has 20,000 people.
Yeah.
1% of 20,000, that's a big number.
Yeah.
Okay, so 80%, let's say only half our county were to get infected. Okay? Kind of going on the national average of what they're predicting, say 10,000 people get infected in our county. 8,000 will have a mild to moderate flu and are going to miss 3 to 4 weeks of their life. Okay, that's 8,000. 15% of that 10,000, so 1,500 people are going to wind up in the hospital. Best I can tell, we have one hospital in our county with 22 beds.
Yes.
We can't fit 1,500 people in those beds.
Yeah, exactly.
Now, they're not all going to get sick at the same time, okay? You've heard the phrase flattening the curve, I'm sure.
Yeah, that's what they talk about.
And so
15 days to flatten the curve.
Right, so if we don't flatten that curve, in 20 to 25 days, we're going to need 1,000 hospital beds.
Yes.
We don't have it. Nobody has it.
Nobody, yeah.
What's going on in New York will not be isolated, okay? They're currently seeing this astronomical exponential curve that's happening. Their governor, Cuomo, is a fiery little guy. You watch him on TV, and he's got every right to be, because he is terrified about what's about to happen to his state.
Yeah, I mean, it's bad there. I mean, thankfully, right now, we don't have the National Guard patrolling our streets.
Correct.
They do.
Right.
They do.
And this is very real. This is not something that might or might. This is going to happen. We are going to get a crunch for people in our county. Okay, our hospital has 2 ventilators. One that's old that we've refurbished and it works fine, but nonetheless it's older. One that we bought a couple of years ago and it's very nice. So going back to that 10,000 people getting sick, 1,500 wind up in the hospital, 500 are going to need a ventilator.
Yes.
I got 2.
Yeah.
So the only thing that we can do is this social distancing.
Exactly.
And if we do not do that, we will be overrun with patients that we cannot take care of. And, you know, you guys that know me, I have an arrogant streak a little bit about medicine. I think I can do a lot of things with medicine, right?
Well, rightfully so. I mean, you went and got your medical degree. I don't have my medical degree. So.
I know where my limitations are.
Yeah.
My brother does, Dr. Roden do. We all, Dr. West, we all know where our limitations are. And managing a ventilator, we can do. We've been trained on it. We know how to do that. That's fine. But I can only manage 2 or 3 people on the ventilator. I can't manage 500.
Yeah.
So if we don't significantly change the curve, we're gonna be in a bind.
Yeah.
So I'm gonna have to choose between you and Rob and somebody else who's
Exactly.
been on the ventilator.
Well, that's what they said they were doing in Italy. I mean, people
Right.
would come in, they're choosing who lives and who dies.
Exactly right. I'm not God.
I know.
Never wanted to be. Never thought I was. I don't want to make that decision.
I know.
But it may be forced on me based off of these numbers that we're looking at.
Yeah.
And so the only thing that we can do to fix that is stay away from people.
Exactly. I do want to get back to that too. I did have another question though, going back to the drugs, because recently, I mean, there was a small study in Italy, and I'm sure you've heard of these two drugs. I'm about that. Forgive me if I mispronounce them. Chloroquine and
hydroxychloroquine.
Yeah. So there was a 40-person study, I believe, and they said it was 100% effective. But they said that's not a large enough trial for it to happen. And there was a guy, I don't remember the state, but he apparently popped some when he was showing mild symptoms.
Either Arizona or New Mexico, I'm not sure.
Yeah, and he passed away from it. And so
he overdosed on it and it killed him.
Yeah, what are those drugs? And then I guess, I don't know, there's not proof that it works on them exactly right now, but how would they affect your system?
Those medications are tried and true for what they're used for.
Yes.
They're anti-malaria medications, and they help with rheumatoid arthritis. Some of the rheumatological disorders they do help with.
Okay.
However, they have serious side effects.
Mm-hmm.
Can damage your kidneys, can damage your liver. And so people just going out at the clinic.
Yeah.
I've had two requests.
To request for the
Just me.
drugs?
2 requests in the past 2 days. Would you please prescribe me some of that medication? No, I cannot. First off, it's restricted use right now because of this. You have to have a pre-existing diagnosis of malaria or rheumatoid arthritis. So even if you, Cole, wanted me to get you one, I can't. The pharmacist can't dispense it. I can't write it. So number one, that's off the market right now until there's further studies. It looks like out of Italy that it may be helpful.
Yes.
But 40 people is not enough to put thousands on it. And to see if it's going to work because of the significant side effects that it has.
Yeah, that's what Dr. Fauci said. He didn't say it wasn't not a solution, but he said that we need more trials, and I believe that's what they're trying to do. From my knowledge,
if my information is correct, they're going to have a study in New York State over this medicine. They're going to try to enroll people in it that volunteer for the study. So hopefully that will give us some information.
Yeah.
The third drug that you're missing in that also is azithromycin or Zithromax.
Yeah, I've heard of it, but
it's an antibiotic. It doesn't kill the virus, but what it can do is possibly limit your bacterial exposure.
Okay. That's
also currently limited by the Food and Drug Administration to specific reasons on why you're using that medication.
Yeah. See, because I thought it was promising, but I mean, I was also worried because just like you were saying, it causes these side effects, and then people would just go out there and start popping them like candy.
Right. So, if I've got somebody who is COVID-19 positive tested and they're sick, I would put them on that if I could to see if it could help that person.
Okay.
But as far as you calling to the clinic and saying, hey, I had exposure, I need you to write me that.
Yeah.
I can't legally write it for you right now.
Exactly. Okay. Yeah, that answers, everything I wanted from that.
Hey, Cole, do you know anything about that new Anchor.fm thing?
Oh, yeah, I love Anchor. I've done many things in the podcast world, and Anchor was probably one of the best things I've ever found. It's, at least in my amateur life, it's a podcast hosting website. It's owned by Spotify. It's free. The best thing about it is that you can use your tools, and even if you're skimping or low on money, you can record your entire podcast on your phone. It's great. It's one-click distribution straight to Spotify, Apple Podcasts, and many more. I can't say enough good things about it. The editing tools, the way that they give you sponsors, and everything more just makes it a great podcast hosting website.
That sounds fantastic. I think I'm going to sign up today.
We should.
Yeah, you should download the free Anchor app or go to Anchor.fm to get started.
Yeah. So I kind of wanted to move in on this section, getting off the virus a little bit and kind of talking about our hospital, our clinic in general. Because I see some stuff y'all are posting on Facebook, and I don't know, not everybody might not have a Facebook, or they may not see the hospital's pages. What are y'all's procedures right now as our county stands in this situation?
If you, Cole Jackson, call up to the clinic, we don't want you to just show up at the clinic or the ER.
Mm-hmm.
We want you to call and say, look, I think I've had an exposure. Let's forget the exposure. I'm sick. I've got cough, cold, congestion, and fever. There's a questionnaire produced by the State Department of Health and by the CDC that the person answering the phone is going to ask you. And depending on your answers to those questions, you'll be directed on then what to do. If your answers do not trigger further questions, then you'll come to the clinic, you'll be screened with temperature, and then you'll be taken back to your room and you'll be seen by the provider.
Okay.
If, let's say, you have positive answers to these questions,
Yes.
then we will direct you to come to the clinic and wait in your car. Call the clinic and say, I, Cole Jackson, called earlier, had a positive questionnaire. You told me to call when I got to my car, or when I got to the clinic, I'm in my car. A member of the clinic will come to your car and do the first of the couple tests that we do.
Okay.
And all of this is directed by the State Department of Health and
Yes.
by the CDC. So you'll get a flu test and a strep screen. Depending on the results of those, depends on what further testing we do.
Mm-hmm.
If those are both negative and you have a significant contact, then we will do further testing. Right now in our hospital, I believe we have 10 COVID-19 tests.
Okay.
That not very many.
Yeah, no.
So we cannot test everybody that wants to be tested yet.
Mm-hmm.
I know our president has guaranteed that anybody that wants a test can get a test.
Yes.
We don't have the testing capability yet.
Yeah.
The testing is being ramped up. We expect more tests to be coming in, but we don't have the testing capability to test everybody that wants to be tested.
Okay.
Case in point, we have had a patient in Nocona test positive for COVID-19.
Okay.
I can't talk a lot about that because
I
of
totally
the HIPAA
understand.
laws that
Yeah,
that tell
exactly.
that. But I saw this patient. They did not meet testing criteria, and they were not tested.
Mm-hmm.
They continued to be sick and went to hospital in Wichita Falls, where they were then admitted, and further testing was done up there, and they've come back positive. And they were told to contact all of their people they've come into contact with. So that family called us today
Okay.
and said, hey, this is what's happened. So I had contact with that person, what I think would be considered a mild contact, in an exam room with them for 20 minutes or so, doing the exam, talking to them.
Yes.
And I would love to be tested,
Mm-hmm.
but I can't because I don't meet the testing criteria.
Yeah.
And so not everybody who wants to be tested is going to be able to be tested. But if you think that you have an illness, call the clinic, 825-3333, call the hospital, 825-3235, and they will direct you further in what then needs to be done.
Okay. Yeah. So, I mean, we've kind of elaborated on it, like what I guess our hospital is basically, if we're prepared, because that's what kind of started this, because someone posted on Facebook, like,
We are as prepared as we can be.
Exactly. That's all we can. That's all we can ask for right now. And like there are many, like we said earlier, there are many communities that aren't nearly as prepared as us.
Let's assume that you come to the clinic and you have a significant contact.
Mm-hmm.
You've been in contact with somebody from one of the hot zones. You've been, whatever. You have the correct answers or incorrect answers, I guess, whichever you want to look at, the wrong answers. And we think that you've had a significant contact. So we do the strep and the flu test, and they come back negative. We then have to talk to the State Department of Health to see if we can further test you. And if we think that you have significant issues and the State Department says yes, we bring you into a separate entrance at the hospital that has been sealed off. You come in an outside door. We come in an inside door. Gown up, glove up, put on our protective equipment, personal protective equipment, gown, mask, goggles, N95 mask, which we have a very short supply of those at our hospital.
Mm-hmm.
We go into the room and then we test you.
Okay.
That room has been stripped bare. All it has is a chair and a chair.
Okay.
A chair for me to test you and a chair for you to sit in while I'm testing you. If we need x-ray, we can bring our portable x-ray machine into that room and do an x-ray. So we can do what we need to do in that one room. And depending then on how sick you appear to us, you are either sent home to self-quarantine until we get your test results back, which can be any matter of 4 or 5 hours to a couple of days, depending on what lab we have to send it to.
Okay.
Or further, if you need to be in the hospital, currently we don't have the ability to do that.
Yes.
Once we have a patient who tests positive that needs to be in our hospital, we have the ability then to quarantine them off in a separate spot.
Okay.
We're following all the CDC guidelines, all the State Department of Health guidelines on how to treat that patient.
Okay.
As of today. Tomorrow, those guidelines may change because it's all a very fluid environment.
Exactly. Yeah. I mean, it's changing every day. Just a question, because I didn't personally know if someone had tested positive yet. That was learned right now. You said he or she went to Wichita Falls. So when that number gets reported to the state, because you see on the news, the rising counters, does that get reported in Wichita County, or does that get reported for Montague?
I saw a thing from the county health officer today on Facebook.
Okay.
That said a Nocona area resident tested positive for COVID-19 and is currently in the hospital at Wichita Falls.
Okay.
So I don't know how that ultimately is reported to the state, but they live in Nocona.
Okay.
I don't know if it's in the city limits of Nocona, but the greater Nocona area, that person lives in north half of the county. And so I would assume it would be counted as a Montague County positive.
Okay.
I don't know that, but that's my assumption.
Okay, because I was looking at a map today, and Wichita County, they're going up, and I still had us in gray.
Our Archer County is going up. Yeah.
So this is kind of, I don't know, I've been seeing this on the news, and it just popped into my mind, and I just thought I would ask you, is there a scenario or a possibility where, like, those blue pop-up tent hospitals, we reach capacity or whatever, is there a scenario where we drive by the hospital and, one of those tents is out there popped up and we have people on cots or getting tested in that tent?
Yeah, that's certainly possible. I know that Gainesville and Wichita Falls have drive-through testing.
Okay.
Meaning you call up to whatever the number they've given you is. If you meet the criteria, you drive up, they test you in your car, you go back home. If the numbers start to go up and more tests become available, I can see that scenario happening in Nocona as well. We certainly have the space around the hospital that we can do that.
Exactly. Yeah.
Our footprint there is really nice. We have a lot of space. So we clearly don't have enough hospital room space, bed space for even 100 patients.
Yeah.
Even not even a tenth. So what is 100th of the people in our county that could get sick? We don't have the space for that. So could we wind up in tents? Yes. Could we ultimately have to take over a gymnasium and have cots in a gymnasium? They had to do that in Wuhan, in the Hubei province in China. So those things could happen. I hope not.
Yeah.
Because, then it becomes not just a matter of beds, but of medical personnel to be able to take care of that number of beds. We're going to run out of that as well.
Yeah.
Nocona, again, not a big people place. We don't have a tremendous amount of nurses just sitting around idly, not doing anything. They're all busy doing stuff. So we could run into that problem as well.
Yeah. I certainly don't know what's in the mind of the commissioner's court, but, Tarrant County, they went shelter in place, significant more numbers than us. Denton County went shelter in place, significant more numbers than us. I think Brazos went shelter in place. That's College Station, significant more numbers than us. I have to believe that Wichita County is probably not far behind. What scenario do you believe that we need to shelter in place now, or like what do you think we're doing okay considering the numbers?
Being the father of two 20-somethings and two teenagers, it's difficult to have everybody shelter in place.
Yes.
I meet some resistance with that in my own home.
Yeah.
We talk with Judge Rick Lewis, the county judge, daily.
Yeah.
Sometimes twice a day. Again, everything's fluid. I do see the scenario where the state is going to shelter in place.
Yeah, he's left it up to the counties right now.
But for now.
Yes.
But this was going to change. I think that we are at the very tip of the iceberg. My family called me an alarmist, and I like to think that I'm a realist. I think we're at the tip of the iceberg in the state.
Yeah.
Things that I've read suggested that Dallas County was going to be the next New York.
Oh, yeah.
that Houston's already going crazy.
Mm-hmm.
So do I think that ultimately Monte County will be shelter in place? I do.
Yeah.
I think that's going to happen. Otherwise, exponentially, you see that the numbers are simply math. The numbers are not, I may or may get sick, or I may. The numbers are simply statistics, and the statistics are staggering if we do not flatten this curve.
Yeah. When I assume y'all are counseling the judge on this decision, would you say, the numbers are low right now, let's just do it so, we don't get anything else coming through here? Or are you saying, like we have a little bit of time, or do we have time? Like, are there people walking with it right now here that we just don't know about?
I would wager a large amount of money that there are people walking that have it that don't know it.
Okay.
Do I think we need a shelter in place as of today? No.
Okay.
I think we certainly need to stick to the no more than 10 people and try to be 6 feet apart if you're having a group meeting. It's a difficult question to answer, Cole, but
I understand.
I think that ultimately it's going to happen.
Yes. Okay. Yeah, I was just wondering because I don't know, because I've seen it from both sides, and we don't like to get political on this show or anything. Like we say that outright, but I was just wondering your opinion, because some people have said, if you don't have cases, do it now, and then you won't see any more cases. And I don't know if I entirely see the entire logic of that, because there may be people walking with it right now they don't know about. So I just wanted your insight on that. And
I read a thing on first off, I don't have Facebook. I don't do social media.
Yes, that's smart. If I didn't have to have Facebook, I wouldn't.
It frustrates me. To be politically correct, it frustrates me when uneducated people give their opinions on a lot of things.
Yeah.
And I'm not, uneducated is not a bad word, right? I'm not a lawyer. I'm uneducated on the law. I'm ignorant of the law. So that's not a bad word.
Yeah, I mean, I'm uneducated about medicine.
That's why we're here. And so when uneducated people are on social media telling in non-truths,
yes,
that's very frustrating. And so I don't get on social media because of a lot of those things. But I was shown this thing that it was on Facebook, and it was by a superintendent. I don't know his name, and he was addressing the closing of his school for the following 3 weeks.
Mm-hmm.
And what he said was very poignant and very, very to the point. And he said, in the end, it will be impossible to tell if we overreacted or did too much.
Yeah.
But it will become quite apparent if we underreacted or did too little.
Yeah, and that's what I'm worried about. I'm worried about, the underreaction. I'm also worried about, the overreaction too, because if we actually, they're saying, because if we do the right thing, and, it ends up not as bad as we thought it was going to be, people are going to say we overreacted.
Right.
When really we acted correctly.
Yeah, and we're just not going to know that.
Mm-hmm.
But if we underreact,
we'll know.
We'll definitely know.
Yeah.
Different point. The older you are when you get it, the worse it is.
Mm-hmm.
You happen to be born to older parents.
Yes.
Your parents are in their 60s.
My dad I'm worried about it because my dad does have a pre-existing condition. I mean, I'm not afraid to say that he has diabetes, and that's one of the at-risk factors. Right. And that's why I'm again thankful for the hospital we have, because he can go get checked for his diabetes when he needs to.
How old is your dad?
He's 65 now.
65. Okay.
Yeah, so he's at the at-risk. He
is definitely at the at-risk age. 65 is where it starts. So would you rather us congregate and...
my personal opinion,
right.
No.
Exactly. That's the whole point. We all have an older relative, sibling, brother, sister, aunt, uncle, grandparent, that we don't want them to get it.
I mean, I have a friend that I graduated high school with. I'm not going to name their name, but I know that they have a very significant pre-existing condition, and I can't imagine how her parents might feel or how she feels, and
exactly.
so I'd stay home.
If we don't, I mean, just think, if you infect 3 people, and they infect 3 people, and again, you take that out to a power of 10, you're into the 30,000 people just from you.
Yeah.
So I don't want to be responsible for that death.
Exactly. Exactly. It would weigh on me heavily. I just know that very much. So no matter who it was or, just anybody. And like I was talking with Rob the other day, I mean, we're naming all these statistics like flu kills this many people a year, this is killing this many people. I'm like, that's a lot of people that are dying that I don't want dying, because that affects more than just the person that goes 6 foot under. It affects, 50 or so family members that had to impact with that death. So yeah, that weighs heavily on me, and I know it weighs heavily on you.
Yes.
Sorry, we're filming this outside, and a guy's passing by in a lawnmower. It's normal. Yeah, we're keeping our distance. It's normal procedure around here. Chance, I do want to thank you for coming. It means a lot, really. Oh, he has a question for you. He wants to know if the president is hopeful that we can have reopen by Easter. What? The borders. Is that recommended?
No.
No? You don't think we're going to meet that deadline?
No. I don't think that we're going to be open for business until late summer.
Yeah. That's kind of what I was feeling too.
We don't know if this is seasonal. Okay.
Yeah.
Australia has only had like 2,500 cases the last time I looked. So northern climates are having more than that. So we think it may be a seasonal effect, but we don't know if it's going to come out again this fall. Again, we don't know these things. So Trump wants the economy to open.
Yes.
And I get his point.
I get the point too, yeah.
People are not able to work. People are not able to feed their families. This is a terrible tragedy.
Yes.
Having said that, what's the risk to the human life? So if it hurts everybody, my pocketbook too. People are not coming to see me in clinic. I mean, I'm not making money right now.
Yeah.
I know a lot of oilfield workers are getting laid off. I know that people who work in restaurants are getting laid off. It's terrible all the way around, and I understand that. But if we can prevent mass casualties in the U.S., is it not worth a little more self-sacrifice from all of us?
Yeah. No, I totally understand that point. I feel the same way. Some others may not, and they're welcome to that. But that's why I wanted to talk to you. You're the guy with that's going to be on the front lines for us, and I'm entirely thankful for that. I'm thankful for you talking to us because I wanted to get information out to people. That's just who I am as a person. I knew I needed somebody that would be able to talk these things out. I do have 2 more questions to you. I want to get you back home to your family, and these are not as tough, I guess. So I would say, but the first one would just be like, my mom. She is. I wouldn't say she's super panicky, but she's telling me to pop vitamins every day.
Okay.
And what's just some good general health advice in this time to prepare you?
So good question. Health advice, not just in this time, but in everything.
Mm-hmm.
Flu season, COVID-19 season, makes no difference.
Yeah.
Plenty of rest. If your body is not resting, then you're not repairing your damage. So when you're asleep at night, your body's recovering.
Mm-hmm.
Appropriate nutrition. 3 squares a day, 3 good meals. Plenty of fruits and vegetables, and that's the thing that we lack in our diet.
Yeah.
We're all good on the meat and dairy, but we're not good on fruits and vegetables. So eating appropriately. My personal take on multivitamins is if you eat a good, healthy food pyramid diet, you don't need them.
Okay.
None of us eat that food pyramid diet.
Yes.
None of us, a few of us grow our own fruits and vegetables, but the majority of them don't. They buy them at Walmart, here at Marketplace, and these are not vine-ripened vegetables. They're not vine-ripened fruits. They ripen on the way to market, and they do not have the out-of-the-ground nutrients and proteins and things that our bodies need that our great-grandparents did. So, yeah, I think a multivitamin right now is an excellent choice. In general, you don't need it. I'm taking them right now.
Yeah.
And I'm doubling up. So if you're asking me which vitamin to take, a good multivitamin, all the wives' tales say vitamin C, zinc, magnesium, all these things are helpful for your body to fight off viruses. So I'm taking all of those right now as well. My family is not. I can't convince them
my
to
mom's
take them. But I am taking them because, number one, if I get sick, who's going to take care of you?
Yeah.
So I am doubling up on all those things. I'm trying to eat as healthy as I can. I'm working out every day. I greatly enjoy working out, and I'm working out every day. I did a lot of running yesterday. Today I did lifting.
Always been
And
an active person, as
always been
much
active.
as I've known you.
Always been active and always going to stay active. I love doing my martial arts, my taekwondo.
Yeah.
I'm doing that. It's a great release for my pent up stress and anxiety.
Exactly.
But appropriate sleep, appropriate diet, plenty of water, and a multivitamin today is a good thing.
Okay, yeah, 'cause my mom's nagging me if I don't take my vitamin C, she's fine. And then Rob over here, he'll tell you that he's been applying hand sanitizer so much that it's drying his hands out. How much is too much hand sanitizer? And like, what point do you kill the germs that you actually need on your hands?
You can't use too much.
You can't use too much. Okay, there you go. Rob's got his question answered.
No one washes their hands more than medical professionals.
Yeah.
Anyway,
Mm-hmm.
right now my hands are bleeding
Mm-hmm.
because of the number of times that I wash them in a day.
Okay.
I sing happy birthday to myself about 30 times a day.
Yeah.
Right? So happy birthday is about 20 seconds. That's about how long, if you're using regular soap and water, about how long it takes to disinfect.
Mm-hmm.
I'm doing that with hand sanitizers as well. So I'll do hand sanitizer after one patient, the next patient I wash, the next one I
Yeah.
hand sanitizer, the next one I'm washing.
Yeah.
So I do a lot of back and forth with that, but I am washing like crazy, and I think Rob's got the nail on the head. You can't use too much right now.
Mm-hmm.
Don't go hoard it, right?
Yeah.
Don't be like the guys in Kentucky and buy 19,000
Trying to sell it
separate-
on Amazon.
right,
Yeah.
and then get stuck with it. And those guys donated it, thank gosh, to people that needed
Mm-hmm.
it. But use hand sanitizer and use soap right now. It's what you can do to help yourself.
Yeah. Okay. Yeah. And then the final question I have for you is, you were talking about how y'all need stuff. Y'all need stuff, and not normal citizens can't get you the critical stuff that you need.
Correct.
But what can citizens help y'all out with right now? Why we don't have those people taking up that space? What can we help y'all? Meals,
I'm not plugging any particular group,
Mm-hmm.
but Thomas Tyler and Edward Jones bought lunch for the hospital yesterday.
Yes.
Very, very nice gesture.
Mm-hmm.
And I'm not saying the average citizens can't go out and spend $2,000 or whatever
Exactly.
they spent and,
Yeah.
and bring food, but it was a great gesture by Edward Jones and Tyler.
Mm-hmm.
Making masks,
Yeah.
even a cloth mask will help.
Mm-hmm.
So some of the people at the hospital are making masks right now in the event that we have a shortage. We
Yes.
currently don't, but we will if this hits like here in North like we expect.
Mm-hmm.
And they can get a hold of some of the people at the hospital that are making masks and figure out how to make them and what they can do for them.
Yeah.
In Gainesville, I was just told earlier today that a couple of the nail salons, who are people who are not busy, are making masks. All they ask for is donations for the
Yeah.
material. And they're making double-layered cotton masks with a layer of some sort of absorbent material in between that
Okay.
to try to help out. We're trying to save the N95 masks for
Go
high
time.
risk
Yeah.
people. But if you come in just regular cough, cold, congestion, I'm going to put a mask on right now anyway, and they're trying to make enough masks of those that we can have for everybody.
Okay. Yeah. All right. Yeah. That's great. Yeah. I do want to put that out there. Like I want people to help y'all right now when we're not, like, we're still walking around right now.
It's not a crunch time.
So
So, if you happen to be at whatever your store you're at,
Mm-hmm.
and they have a couple of bottles of hand sanitizer, buying one for yourself and one for the hospital.
yeah.
That kind of stuff is always beneficial.
Yeah. So y'all are definitely our front line, and if it gets bad, I mean it's we're gonna need y'all. So I'm very thankful. I'm very thankful again for you coming on. I love your family, and I love your son, even though I don't see him very much anymore, as much as I'd like to at least. And I'm just glad. I hope this finds people and gets some good information out there, because I know it's hard to find.
Well, we're happy to serve. We're happy to answer questions. And remember, this is the final point. If you think you have a significant exposure and you're ill, do not just drive up to the clinic and infect other people. Call the clinic, 825-3333, or hospital, 825-3235, and we will direct you in what steps you need to take and what we'd like you to do.
Awesome. Thank you so much, Chance.
Anytime, Cole.
Why would you look outside yourself when you have all of the world inside?